Well, after an all-time low of not even phoning in our last episode of 2020, Matthew Holt tweeted it in because our Wi-Fi was so bad. We're here to kick off a brand new year with renewed vim and vigor and energy and better Wi-Fi. It's the first episode of 2021, the January 6th episode of Health in 2.0.
So Jess, you've been driving across the country, seeing how fantastic the infrastructure is. I was in Tahoe, seeing equally how bad it was. Mm-hmm. Is it infrastructure year? We've been waiting for infrastructure week for a long time. Is it infrastructure year now?
I think so. I think that this is a problem that must be solved, particularly with all the telehealth that's supposed to take hold this
Absolutely.
year.
Billions of dollars for Wi-Fi and telehealth.
Writing on it. Venture capitalists, note, please. Guess
who's not going to be spending billions of dollars?
Could it be our friends at Haven?
Maybe not them. they're calling it quits.
So what's funny is that I got somebody messaged me and they're like, if Haven is closing its doors, and I'm like, didn't this already happen? I thought it already happened. Oh my God, I jumped the gun. So I jump ship mentally when Atul Gawande jumped ship physically.
Well, I think that they probably actually did come in quite smart, right? Which is they built this primary care system. And then basically Amazon looked at them and went, that's pretty clever. We could build it out and add it to our stuff and sell it. And they're doing that, right? Amazon is already doing that. They've got the virtual care. They've got the primary care group. They've got PillPack. They're now adding pharmacy. They've just done the deal with your buddies at Crossover Health. There's a lot there. And I think if I'm Jeff Bezos, I'll look at this like cool thing and go, well, why do I want to share it with those bozos over at
Screw you, Warren Buffett.
Yeah, screw you, Buffett. Screw you, Diamond. You can do your own thing. And there are, but I guess all the people working with them, like Utopia and others, will just go back to what they were doing at Chase or wherever, and none will be any of the wiser. Still, you don't want to see these things collapse completely, but I think some of the remnants of it will actually show up elsewhere. Maybe.
I think it's funny if you look at the body of articles that have come out about what went wrong. It's like so much about what went wrong, little to nothing about what they actually did do.
Well, that's because no one quite figured out what they did. Apart from,
All right, well, let's figure out what some of these companies that have raised money have done. Are you ready over there with your timer?
I have my timer. I have the wrong timer. I don't have the one with the rooster. They'll put the rooster on the end. Our special effects guys. Okay, ready?
We're special effects guys.
But now you wasted 5 seconds laughing. Ask the question.
And on that note, Color raises 167 million. What does this company do, Matthew?
So Color was one of the companies came out a few years back. It was going to do genetic testing and change the world of healthcare, blah, blah, blah. Didn't really move the needle too much. And then all of a sudden, this thing called COVID-19 arrived. They got into sorting out the test. They're now the major tester in the San Francisco Bay Area. And they do all the cities and counties testing here. And they've got both the testing bit and the front end information. Interesting company, actually, very interesting, growing super fast. So, I think we'll see if is there life for these guys post-COVID. That's the big question. But for now, a ton of money because there's a ton to be done in COVID, both testing and vaccines, and not only here, but also probably abroad as well.
82.5 million for 23andMe. What do you think about this new money there?
Somebody who knew how to do testing in the home and then doesn't seem to have gotten COVID at all, and yet was going to go public and now is raising a bit more. I'm confused. They'll probably get out the door. I predict a SPAC for these guys.
Oh, you do? Interesting. Okay. RapidSOS, they get 51.2 million. They raised some money over the summer. Remind us what they do again.
Yeah, this is a back-end infrastructure play for 911 calls. And now I've told you everyone know about it.
Okay. What about Fruit Street Health? You know anything about them? This is chronic condition management, 22 million for them.
This is a weird one because Fruit Street keeps on saying how much money it's raised. I saw they didn't have very much in revenue. It was like in the low millions. Doing kind of like Armada, doing the DPP programs, the rest of it, and then moving to some other areas. They've been raised all their money in small pieces from doctors, and they now raised another couple of 20 odd million, in onesies, twosies. So interesting. They are like number 7 in that category. So good luck.
All right. What about Centene acquiring Magellan for $2.2 billion? This is so interesting to me. And together we learned that Magellan had a very, very lucrative PBM attached to it. Who knew that?
Oh, our research in this show is like out of whack. I mean,
stellar, like the special effects that those special effects guys do. Our research team does an awesome job as well. Let's shout them out.
That was us.
Who are these?
Okay. Shall I tell you what I know?
Yes, please.
I mean, we could be going on the 2 minutes here. So Magellan forever has been a mental health services company, right? Helping coordinate mental health, basically subbing out to health plans because they don't want to do their own dirty work in the mental health area. And as you noted, they bought a specialty pharma group, which has now grown as bigger than their mental health section. It's like grew like 100% last year in terms of specialty pharma management part, and there's addiction, all kinds of other stuff going on in that world. So interesting. Now, Centene, on the other hand, has grown primarily by adding as a health plan, big health plan, $35 billion market cap, by adding WellCare and HealthNet and a bunch of other well-known names, primarily in the Medicaid and some Medicare Advantage parts. So it's like, so you can plug those two things together and go, well, where is a lot of specialty pharma used? Where is a lot of mental health used? Yeah, that Medicaid area. And by the way, Medicaid is going to grow because of the Democratic administration, plus the fact we have this small recession. And you can imagine mental health issues possibly have increased with the recession. So we COVID and all the rest of it. So it's an interesting area. It's a sizable deal, but it's a name that's been around a long time. But $2 billion is chump change these days in like market cap, right?
I mean, yeah, at this point here.
when money losing companies with no revenue are going for like 20 billion, whatever.
Yay, 2021. Off to a stellar start.
Well, it's interesting that it does show that there's going to be some movement in traditional healthcare services and insurance players towards the areas that we've been talking a lot about. And I would expect that you'll get a lot of, Centene, by the way, has already put some money in people like they bought a Pixio, which is a coding company, the other day. They bought, they put some money into Babylon. So you're going to see a lot of these things, pieces together. Obviously, United is going to be the big player, putting more and more of these big pieces together. But there's going to be a lot happening in the health plan world as they kind of figure out the new era that we're going into.
Yes, indeed. And to make sure that you are equipped with all of the important intel that you need to arm yourself for this new era that we're heading into.
I just made up a new era. It's the same old COVID nonsense for the next 6 months plus, or we're figuring out the vaccines.
You've made up a special effects team, you've made up a research team, and now you've made up a new era of healthcare. You're killing it already this year. To make sure that you never miss any of these brilliant insights and what's coming down the pike, whether he makes it up or it's really happening, sign up for our email newsletter over there at the Healthcare Blog. That's a real thing. It already does exist. And you can also follow the guy on Twitter. That's also very real, sometimes too real. He's at Bolty Boy. I'm over at Jess and Matthew. Thanks so much for joining, you guys. It's a pleasure to see you back again this year for more health tech funding madness. Can't wait to see what happens next. We'll see you guys soon.
Ching ching to 2021.
Oh, ching ching. Imaginary champagne.
Imaginary
Why
champagne.
aren't we at JP Morgan?
We're drinking imaginary champagne, Obi.
Should be at JP Morgan. All right, guys. We'll see you soon. Bye.